Welcome to As a Woman, Fertility Hormones and Beyond. I'm your host, Dr. Natalie Crawford, and I am a board-certified OBGYN and fertility physician, and also co-founder of Fora Fertility in Austin, Texas. Each week on this podcast, I discuss health and fertility and how they relate to your true self. Become a part of the community of collaboration that amplifies others as a woman. I hope you enjoy the episode. Hello and welcome back to the As a Woman podcast. I'm your host, Dr. Natalie Crawford, and today we are diving in to IVF, reproductive rights, some comments and questions that I've been getting that I think are very wonderful questions and coming from a place of respect and curiosity. Whenever we talk about anything that could be political, people feel very strong, and I am not here to make you feel one way or another. I'm not here to make you vote a certain way. I, in fact, really do want you to vote. Register to vote and show up to vote for whatever matters to you. At the time of recording this episode is being recorded September 13th, 2024. So this is before the presidential election. And I know many people watched the debate between Donald Trump and Kamala Harris this week, and that really posed a lot of questions. Anytime I try to talk about reproductive rights, which is in my area of expertise as a trained OBGYN and as a fertility doctor who does IVF every day, I have some of the most vile comments coming my way, to the point where we have to block emails, restrict comments, and that's really not okay. Meaning, one of the things that makes America great is that you can have a personal belief, but you don't need to impose it on everybody else. That's what religious freedom is. That's what our ability to vote says. I get to show up and vote for who I think will be the best and the things that are important to me. One thing that bothers me right now is we are seeing people impose their beliefs onto an entire state or country. But in my comments, there were really some great discussions because I know most people aren't on either end. You're not sending me vile emails, but maybe you truly are curious about some of the things you're hearing, and that is complicated. And I love having educated discussions from a place of curiosity and respect. So today we're going to break down reproductive rights, why it matters to IVF. This is the first time the words IVF have even been said on a presidential debate stage. That alone is monumentous. That's amazing and incredible. That's something so many people didn't even know about. We're now even bringing up in conversation. So welcome to the As a Woman podcast. I'm your host, Dr. Natalie Crawford. I'm a board-certified OBGYN and I'm a board-certified reproductive endocrinologist and infertility specialist, which means I'm a practicing fertility doctor and I do IVF every single day. I help people grow their family, preserve their fertility, and keep options open so that they can have a family of their dreams in a safe way. So often we don't understand what really goes into IVF, why it is so tied up into reproductive rights and the abortion discussion, and we don't always understand why some of these words and their definitions are really important. In addition, Donald Trump did say some things. One, he said that he's a leader in IVF. Two, he said some false facts about abortion as far as people getting abortion at the 9-month mark, people terminating babies after they've been born, executing babies. Both of those statements are completely false. And he's using that as a fear tactic because he doesn't think you are smart enough to understand the complexity of human reproduction. But I think you are. So to start, Roe v. Wade, which was overturned after Donald Trump elected people to the Supreme Court who he knew would overturn it, was not about permitting abortion. It was about bodily autonomy, meaning you have the right to privacy and autonomy to make your own healthcare decisions, that the government does not have to know nor intervene and tell you what you can and cannot do. That sounds good to me. That sounds very important to me. I think you should be able to make decisions that are important to you. Now, what happened is when that was overturned, that is what permitted states to have different rules when it came to abortion rights, because you had to have access to a healthcare decision that was important to you. But I have to say, I practice in Texas, and things were already extremely restricted and limited in a state like this, because states still had the ability to have their own rules, regulations, laws. The movement by one side of the political agenda to completely outlaw any abortion is really based in a religious belief. And I feel strongly that you should be able to use your religion, your doctors, yourself, your spouse to make your decision. But the decision that you might make and I might make might be different, and that should be okay. We also want to look out for autonomy of a human to understand the complexity of their situation. But if somebody wants to really narrowly put this in a box and say, I would like to outlaw all abortions, what am I going to do? I am going to write bills that say life begins at fertilization, the moment an egg and sperm come together. Interestingly, we know a lot about fertilization because now that IVF exists, and it's existed for over 40 years, we actually can watch and do fertilization in a lab. IVF itself stands for in vitro fertilization, IVF. In vitro, Latin, it actually means in the glass. So if you think about in the glass petri dishes used to be glass, and then fertilization. So you would put eggs and sperm together in that glass petri dish and allow them to fertilize outside of the body, and was invented for people who didn't have functioning fallopian tubes. So if you had tubal blockage and there was no way for egg and sperm to meet in the body, you could take eggs out, put sperm together, and voila, potentially have a pregnancy. When IVF was first started, we didn't have a lot of the technology we have now. You couldn't make multiple eggs grow at one time, so you would just follow the one that was growing. You had to do a surgical procedure to get it out, abdominal surgery. You had to just put sperm close to it in the lab. We now can fertilize eggs, one sperm, one egg. And we didn't understand the development requirements of the culture media. And so embryos couldn't develop very long. We would put them back in the body on day 2 or 3 after fertilization, despite the fact that normal implantation is occurring 5 to 7 days later. IVF technology has improved so much, which is great because it's expensive. And the more technology can improve, the better it is, and the more we can help people. And as somebody who has committed her life to helping people have the family of their dreams, I feel so passionate that we understand some of the basics about what the process is, how it pertains to human reproduction in general, how you can modify it to fit your own personal beliefs and what that means, and why this means that abortion bans are very dangerous, especially for the field of reproductive medicine. When Donald Trump says, I'm a leader of IVF, I want to give free IVF to everybody, that is a very interesting and conflicting statement from a man who also says he wants to support private healthcare sector, so does not want to have government-based mandated insurance, which is what is semi-required if you want to go make IVF free. He also has supported what's called fetal personhood. And this gives a lot of people pause because they think that means after the baby's born or at a certain stage. Fetal personhood bills means that essentially life begins at fertilization. And if life begins at fertilization, it becomes very hard to justify growing embryos in the lab, biopsy them, freezing them, discarding them, transferring them, testing them, transporting them across the country to other places. So if you support people who want to pass bills that actively will restrict IVF, and you know it because people have told you this, but you just want to say that you're going to give IVF for free to everybody, that doesn't track with the other things he supports, his track record, and the actions he's made. So actions speak louder than words. I would absolutely love IVF for everybody. So it's really easy for a man who doesn't understand the process to stand up and say he's a leader in IVF. But to be a real leader, you understand that the other thing that you say, that overturning Roe v. Wade was amazing and wonderful and you're proud of it, and that people were supportive of it, is in direct conflict with being a leader in IVF and reproductive medicine. IVF today allows so many people to have the opportunity for a family, now and later. It can help us overcome many medical issues, but it also allows us to freeze eggs and embryos if you have a serious medical problem. Let's say you're undergoing chemotherapy and you might go into menopause when you're done. Let's say you have a cancer carrying gene that you don't want to pass on. Let's say you watched a parent die from Huntington's disease, which is a progressive, disabling disease, and you've said, I'm never going to have kids because I can't have them watch me die, or I can't see if they're going to die or pass this on. To find out that you could do genetic testing and eliminate this gene from your family line, it is life-changing. For people who've waited to start a family, for people who need to use an egg donor, for people who've had uterine cancer, had to have their uterus removed, now they can have a surrogate that requires IVF. For people who have male factor infertility, for people who have hypothalamic amenorrhea or severe refractory PCOS, for people who want to have a family and have infertility, endometriosis, adenomyosis, secondary infertility, unexplained infertility. There are so many scenarios when people walk into my office and end up needing or relying on IVF in order to have life, to have a child. When it comes to IVF, we get 1 month's group of eggs all to grow. So in your body, you have a group of eggs available, and your brain sends out a hormone called FSH, or follicle stimulating hormone, which stimulates one egg to grow. As that egg grows, it makes estrogen. That's the one you ovulate. And all the other eggs that you are going to have that month die. IVF in its simplest is taking that 1 month group of eggs and saying, I don't want anybody to die this month. I'm going to get you all to grow. So we give medication, we give FSH shots, same hormone the brain makes, just higher, so that we can feed more eggs. Take the eggs out of the body, and then we can fertilize, thus the IVF, these eggs in the lab. And this technology, as I said, now we can pick a good looking sperm. We can put a sperm into an egg. Many people have fertilization issues, so that's called ICSI, and that alone can overcome severe male factor infertility. We then can grow the embryos to that implantation stage now, day 5 or 6, and we can do genetic testing on them. Freeze the embryos, find out which one is genetically normal. And by genetic testing, I don't mean, do you have blue eyes? Will you be tall? Are you going to be a star basketball player? I mean, do you have the right number of chromosomes, which is the low end of what is required to proceed with a healthy pregnancy, because there is so much loss along the way. Even having genetically normal embryo, if I go and transfer that embryo, I'm going to have, at best, a 65% chance of live birth, which truly is high compared to nature, but that's not 100. And that's once I have a genetically normal embryo. Of the eggs that I get, only about 75% will fertilize. Of the fertilized eggs, only about half will grow to that implantation stage embryo called a blastocyst. Of the embryos that make it to a blastocyst, the number that will be genetically normal is based on your age. At age 35, 36, it's about 50-50. At age 40, it's about 25% normal. Based on a normal embryo, then it's 65%. So if you're an average 40-year-old and you walk into my clinic and I get 10 eggs at egg retrieval, which is an average number. At age 40, 10 eggs, very average. We'd be happy with that. 8 of them fertilized, 4 of them grow to a blastocyst. I expect 1 to be genetically normal, has a 65% chance of success, meaning it might not work. You might have to do it again. You might have to go get another month's group of eggs. So for somebody to say that all 8 of those eggs that fertilized are alive, they're not. And countries have had some of these restrictions, and it has devastating consequences to IVF. Number one, countries that want to have life at fertilization restrictions can limit the number of eggs that you can fertilize. You have to throw the others away or freeze them as eggs, and you have to transfer anything that gets to an embryo state, and you can't biopsy it or do genetic testing. So all those people who wanted to eliminate BRCA, Huntington's, all of these single gene disorders, cystic fibrosis, spinal muscular atrophy, they can't do it anymore. I now can only fertilize the number of eggs that I think I'd be willing to transfer based on your age. So if I fertilize 3, I got to be prepared to put 3 embryos in your body, which is not what we do anymore. Now that we have genetic testing, we pick the single best embryo and we transfer that one because that's the safest. That's going to give you the highest chance of a pregnancy and be the safest thing to bring this baby into the world. And we have the other embryos frozen so that if it doesn't work, you don't have to spend 20 grand plus to go through it again because we threw everything away, we're able to say, hey, I have this other embryo. Let's do another embryo transfer. Or if it does work, you can come back in a couple years and we can transfer that embryo. So it's really important to understand that there's natural loss in human reproduction. Humans are not very efficient at reproducing, and countries have limited IVF based on the idea that life begins at fertilization, and most of them have reversed that because it is very ineffective and expensive in a way to get pregnant. So when somebody tells you that, yeah, their political candidate of choice wants to make IVF free for everybody and also believes in fetal personhood, life begins at fertilization, if we live in the world where they are going to make IVF free, they're going to limit it so that I can only fertilize whatever I would put inside. I can't freeze embryos. I can't genetically test them. And that is going to mean it is very hard for you to get pregnant. Did I pick the right 3 eggs from that 40-year-old? Only one of those 10 made it into an embryo that could become a child. But if I'm under IVF restrictions and can only get 3, did I pick the right ones? What's going to happen? Are you going to miscarry? Are you going to carry this pregnancy and then lose it? Are you going to spend months waiting and then we have to restart over from scratch? So the principal idea of IVF is to try to override the inefficiency in human reproduction to try to help more people have families. Nobody is using IVF for designer babies. That doesn't exist. And the decision on what to do with residual embryos is highly personal and very hard. When you are done with your family, if you have remaining embryos, then people might keep them in storage, keep them frozen, pay a yearly fee, and I have a lot of patients saving them for their children, just in case. You can discard them. The body discards embryos all the time, so you can discard them. You can give them to research, to training. You can donate them to other people. And then I talk to people every single day about ways we can make IVF feel better to them. And I've had patients who say, I don't believe in genetic testing or freezing embryos. And we have limited fertilization and froze everything else as eggs. And it is a possible but highly expensive way, but it's possible. And if that's the only thing that suits you, we should talk through that. More often, I will have patients say, I don't want to be in the position to have to decide what to do with residual embryos. So if we can help it, I would rather only create X number of embryos, and any embryo that's genetically normal, I'm going to plan to transfer sometime over my reproductive lifespan. And we have those conversations and what those numbers are. But more people who go through IVF need more cycles. Having an extreme excess of embryos is truly not a problem that most people have. The other thing that we see highly tied into the fertility community, and you might know that in Texas, 20 women are suing the state because of complications from needing a termination and not being able to get one. We have a case where somebody had their water break and got extremely infected inside, septic, in the ICU, almost died. Her uterus is now full of scar. She may never be able to carry again. We have patients who've had to travel out of state who had severe hemorrhaging, left with uterine scarring, left with emergency surgeries that might make their ovarian reserve less or might make it harder for them in the future. I've been a part of cases that have devastated me where very desired pregnancies have needed to be terminated, either for the baby because it's the most compassionate thing, or for the mom because she's so sick. I've had a patient who was in thyroid storm from a pregnancy. It was a partial mole and it was a twin pregnancy, and it had to be terminated because her thyroid hormones were so high, her blood pressure out of control, she would have died. It was devastating. I've had a patient who had leukemia, had no platelets, bleeding out her eye sockets. A termination would have saved her life, and she said no. And that was her right. She got to make that choice. But currently, in many states, you don't have that right. And she left 3 kids without a mom because the choice she made. But she made the choice that was right for her. That choice should be yours and yours alone to make. In addition, early pregnancies are not always normal. Miscarriage management, ectopic management require access to medications that are also used in medical abortion process. In states like Louisiana are limiting access to misoprostol, which is a hugely important medicine in reproductive medicine, in labor and delivery, and not being able to have it in your emergency bleeding crash cart is outrageous to me. One of the questions that I get asked all the time when it comes to talking about abortion and IVF is, number one, do abortion restrictions really limit IVF? And I hope I answered it already, but to summarize, it can change how we do the process and what has made IVF as successful as it is. But still remember that even a genetically normal embryo at best has a 65% chance of turning into a living child. So genetics themselves are the low end of the bar, and a clump of cells has to be able to grow, divide, and organs have to form. There has to be some competency, and most fertilized eggs will never, ever make it to that stage. Also, the ability to freeze embryos has without a doubt made IVF safer and more effective. It allows people to family plan, to save embryos for later, to not have hyperstimulation syndrome, to have higher success rates, to put in fewer embryos. And it's really an important piece of how we do IVF. In genetic testing, I just, from personal experience, can't tell you how life-changing it can be. It can stop miscarriages. It can rule out terrible diseases. And I can't imagine practicing IVF and not being able to offer that to my patients. When it comes to some of the things I hear about reproductive rights and confusion, one is that this idea that because some states do not have an upper limit of when an abortion is legal, meaning a state like Oregon, you could get an abortion, hypothetically, at any time, but not for any reason. And I think that's an important distinction. You can't walk in to Planned Parenthood at 9 months pregnant and say, I've decided I don't want to be a mom anymore. I want to have an abortion. It's not going to work that way. Any place that does abortions past viability, which is 23 to 24 weeks, is one, those account for less than 1% of all abortions, less than 1%. So we're talking a very, very small number. And those are exclusively happening in terrible scenarios that you can't imagine, of fetal anomaly incompatible with life, or mom facing dying, like my leukemia patient. And these are terrible decisions that families have to go through. And the procedure itself is also terrible at this later stage. It is not something that you can just decide to do like potentially you could in the first trimester. When it comes to having an abortion, a late-term abortion, that's not a medical term. And I think that that has been propagated by one side of the political agenda to scare you, to think that people are killing term babies. And that's not the case. Doctors, we have a code of ethics and morals, and number one, if you've never heard it, it's called the Hippocratic Oath, and it says do no harm. Nobody is going to be doing a term abortion or a viability abortion unless it is a context of something terrible and tragic. And a lot of times these involve multiple layers of ethics and legal committees, and you have to go to very specialized centers to have it done. There's also no post-birth execution, and I can't believe I have to say that out loud, but I am, because this idea that a baby could be born and somebody says, I don't want to have that baby, so I'm going to birth it and then we're going to kill it. This was really taking misconstrued from comments on neonatal hospice. So if you do not terminate a baby with a fetal anomaly, you're going to have the decision about what to happen afterward. And what we mainly mean is, do you want resuscitation? Do you want this baby to be intubated, to have CPR, to be in the NICU? And some parents might elect for hospice at this stage so that they can hold their child and spend the limited time their child has with them instead of undergoing these invasive and painful procedures. Also, this discussion is had at the threshold of viability. So if you have a baby that's 22 weeks and maybe right on the cusp of when that child might be viable or not, meaning lungs, organs developed far enough to survive on its own, you will have a discussion with the neonatology team on, do you want invasive resuscitation measures or do you want comfort measures? And that is a personal choice that you and your family should absolutely be able to make. I shouldn't be making it for you. You should be able to make the decision for what is right in those tragic, heartbreaking scenarios. And I think people are going to choose different things based on their own personal beliefs or their religion. And that is what this country is founded on. The idea that we have freedom to believe, freedom of religion, and freedom of autonomy. And I strongly believe that you deserve the right to your own body and to make decisions that are right for it. And when it comes to your family and your family planning, I think that this is a lot more complicated than somebody wants you to believe. I also do not support post-birth execution, also known as infanticide, and it's not real. That's not something that's done. It's illegal in every state. And I think just really understanding some of the scenarios of medically what an abortion is when your water breaks before that threshold of viability. So at 18 weeks, when your water breaks, there's nothing we can do at that stage that's going to help that baby survive the 6 weeks it needs to. I wish there was. These are so tragic, so heartbreaking. But your body doesn't always go into the next stage of labor because it's so early. So often we would need to induce labor so that you could pass this pregnancy. And if we don't, you run the risk of a severe uterine infection like we saw here in Texas, and you could get septic and you could die. Septic abortions are a real thing, and any pregnancy loss or termination is medically considered an abortion. So the induction of labor at a pre-viable stage is a medical tool in order to help someone prevent a terrible outcome. And the last thing I want to say is that if we really roll everything back and say we want to protect life at all costs from the moment of fertilization on, we are also severely limiting access to birth control. So in addition to not being able to control what's happening even in these extreme cases, we now would be in a position where methods of contraception that also impact fertilization or implantation are on the table to also be restricted. And that is very, very scary for me personally. I use birth control all the time as an option to control your cycle for IVF. Not even for contraception, but to be able to manipulate your brain's hormones so I can get the ovarian response I need, or to synchronize certain things. So the idea that medical management options are going to be limited for reproductive care, but also for PMDD, for endometriosis, for irregular periods, for PCOS, for contraception as well, because states have the ability to say, I no longer need to protect your bodily autonomy or your privacy. I get to decide what is right for you based on what my religion is, and I can make you fall into these restrictions, which could stop you from having access to contraception, to appropriate treatment for miscarriage, pregnancy loss, ectopic pregnancy, to appropriate treatment for pre-viable pregnancy loss, for appropriate access to termination, even in medical indications for baby or for mom in scenarios where death is on the line, and to IVF. Can impact your ability to get pregnant, build your family. That's for you, your mom, your sister, your daughter, anybody in your life. So please really ask educated questions about this. This is a year to have difficult conversations, to not say we're not going to discuss politics. We live in a political world. We deserve to have a leader who is going to protect us. And I feel so strongly about this, but I feel strongly that you're armed with information you need to make a good decision. If something sounds too crazy to be true, it probably is. Thank you, friends, for listening to this episode. We're going to have a Q&A on Instagram at nataliecrawfordmd about this subject very soon. I know it's hot and heated, but I appreciate you for sticking around and for trying to get facts over fear. As always, you can get more information on Instagram and you can follow along on YouTube. Thank you, friends. Thank you all for listening to As a Woman. It would mean so much if you could rate, review, and follow the podcast to be notified of new episodes every Sunday. I hope you learned something new, and I hope you share it with someone in your life. Be sure to follow along on Instagram at nataliecrawfordmd, and check out the YouTube channel Natalie Crawford MD. If you're interested in becoming a patient, you can also follow Fora Fertility. I'm so thrilled to have you here, part of the community that amplifies others as a woman.